Welcome to Health Watch, presented by UMass Memorial Health Care, where we're looking at what's new in healthcare. I'm your host, Danny Madison. We're talking about men's health issues and orthopedics, and we're joined by Dr. Michael Brown. Now, looking at orthopedics and men, what injuries do you tend to see the most?
Well, we see different injuries at different age groups mostly. With men at the younger ages, the young men in high school and college age, we tend to see more contact and collision sport type things like football, hockey, things like that. As men progress through life, you see a little more overuse injuries, and then later in life, it could be anything from trauma and broken bones to tendon ruptures.
Men and women tend to have different orthopedic issues and may receive different treatment for the same injury. Can you explain why there's a difference?
Well, oftentimes men and women get the same treatment. In the past, some treatments have been different based on activity levels that were perceived. But nowadays, it's pretty much universal how that you're treated based on your injury and your activity level. There are some injuries that are more common in women, especially at a young age, such as ACL injuries. But as people get older, there's definitely more injuries in men, such as Achilles tendon ruptures, patella tendon, quadricep tendon, bicep tendon. Basically, tendon rupture injuries are much more common in men than in women, especially as men get into their 50s, 60s, and 70s.
Now, specifically, U.S. News and World Report reported in 2014, men are more vulnerable in their hands, upper body tensions, and their Achilles. Do you agree with this?
Well, I think a lot of that is probably related to work issues. I think in general, men more often than women are involved in manual labor and heavy lifting activities, and that can, in machine work, and that can affect hand injuries, upper extremity, shoulder, elbow, hand, wrist, back injuries from just a lot of repetitive lifting.
What do you see most in your practice at UMass Memorial?
Well, my practice is mostly based on shoulder and knee injuries, so I deal with those injuries the most and at all age levels.
Now, if you're looking at someone chronologically, can you talk about some of the challenges they would face as they get through their teens years and into their 20s?
Well, teens in general have more time on their hands. They're more involved in team sports than as we get older and get involved with our life and jobs and things like that. So the teens, a lot more is based on the sport they play. So collision injuries, we see more in the young men compared to older men that get into less contact sports in general. In the younger age is more conditioning and overuse injuries and repetitive use injuries, whereas as men get older, there's more issues with flexibility and conditioning and overuse over time. And then when you start to get into your middle age and older, it's more wear and tear injuries that have built up over years of either competitive sports or just recreational sports.
Now, you mentioned sports. We've seen athletes recover quickly from ACL and MCL surgeries. For the average man, maybe not the Rob Gronkowski type, can they expect a similar recovery?
Well, it's interesting. ACL injuries, in the past, we always thought players would get back to play in 6 months usually, and we've seen that that's usually not the case. Unlike some of the high-profile athletes such as Tom Brady and Rob Gronkowski, most athletes take 9 months to a year to recover from ACL injuries, but most of them can expect to return to high-level sports, and the sport at least at the level that they were competing at before.
Now, for weekend warriors, some people think they could just show up on court or on the baseball field and play and perform at the same level they did when they were little. Why is preparation important, especially if you're going from inactivity to an active lifestyle?
Well, as we get older, our muscles and tendons become deconditioned and a little bit more brittle, and so it's hard to just jump right into sports like when you're younger. So stretching and a gradual advancing in your activities is more appropriate and better to avoid injuries than jumping right in and just trying to keep up with the guys that have been playing on a more regular basis.
What are some of the things men can do on a daily basis to improve their orthopedic health?
A lot of it is things that are just general health things for men and women. Stretching, strengthening, keeping your weight down, overall good diet. Those are things that we could all do to help ourselves.
What about long term?
Long term, it's the same. It's staying in the best condition you can be in. it's exponential, the load on our joints, the more weight we have. So it's every time we take a step, it's 6 to 8 pounds of weight on our knees and hips. And so oftentimes I have to counsel patients on how even minor weight reduction will be an exponential effect on their knees and hips and ankles.
Are you seeing more issues with men who are involved in high impact sports when they were younger versus now when they're maybe less active?
Well, some of these things could have built up or started when they were young. And we see that with men in their 50s, 60s, 70s now that had, for instance, knee injuries like an ACL tear when they were in their teens and 20s. And at that time, the science wasn't as advanced, and maybe they were treated non-operatively, and they've had, for instance, an unstable knee for a number of years, and that does predispose them to more arthritis at a later age. So that's starting to show up now.
Golf is thought of as a sport that is a lifelong sport and that people can play a lot, especially when they retire, as people say. Are there certain types of sports or exercise that you recommend for men in their 50s and beyond?
Well, I think in general, we just try to promote any type of active lifestyle. I think for people that have been jogging their whole life, there's no reason to stop jogging. For people that are more sedentary, starting out with a walking program, downhill skiing, if they're skiers, is a great activity. Swimming's a great activity. In general, it's just good to be active. Muscle training has been shown in older people to be very, very beneficial to avoid injury and to help with their bone health and muscular health.
What about someone in their 30s?
Well, someone in their 30s is right at the transition point. They're the group that they're not quite as young as they used to be. Maybe they have a job and other activities or a new family, so they're not quite as active as they were when they were in their 20s. So they should think about stretching and gradually getting into the activities and not just jumping right back into what they were doing when they were 18.
Spring is here, so people are going to get outdoors. They might go jogging, maybe play some tennis or golf. What would you recommend if someone wants to exercise?
I would recommend starting off slow, gradually getting into it, especially if you've been sedentary throughout the winter. If you've been active and going to the gym a lot and you're in pretty good shape, then you can start going at the level you're used to. But if you haven't been doing much, you should start off with stretching and gradually build up your walking or jogging activities. Don't try to jump in immediately and try to do what you maybe did at the end of the previous season.
People talk about wear and tear injuries. Can they heal over time, or is that just something you have to deal with?
Well, it depends on the injury. If it's a muscle strain type situation, that can definitely heal. If it's cartilage damage, such as early arthritis or full-blown arthritis, unfortunately, those type of things don't usually heal very well.
People always talk about when you're treating tendons, heat versus ice. What do you recommend?
It depends on the time frame. For an acute injury, something just happened, you just sprained your ankle playing basketball, then ice is the treatment. If it's a more chronic thing and you're trying to warm up or stretch your muscles, then heat is more appropriate.
If someone's dealing with soreness or aches, when should they seek medical treatment?
I think if something's been lingering and going on for a while and is concerning, that you should definitely seek medical attention. If it's not too serious, you should talk to your primary care doctor. If it's something much more acute or serious, or you have a swollen joint, or you can't walk because you're in pain, then you should probably consider going to an urgent care or an emergency room setting.
How important is stretching?
Stretching is very important, especially as people get into their late teen years and through their adult years. We don't usually have to deal with stretching a lot in young kid athletes because they're so flexible, but as people go through puberty and beyond, the muscles and tendons tighten up, and stretching is a very important part of exercise.
Someone's returning from an injury, maybe they sprained their ankle or something. What is an important activity that they can do or exercise when they're returning from an injury?
When returning from an injury, you should try to get back in slowly. You shouldn't jump right into an activity if you're recovering from a problem. So if you've been going to physical therapy, the physical therapist will outline a program, or if you're working with a trainer at a school. But you should definitely try to make a gradual transition when you're returning from an injury. You shouldn't try to just jump right back into your previous level, because you may then exacerbate your injury and set yourself back in your recovery.
Dr. Michael Brown, thank you very much. We're going to take a short break. We'll be back with more Health Watch In Depth right after this.
When it comes to healthcare, one phone number is all you need to remember: 855-UMass-MD. 855-UMass-MD connects you to our network of more than 1,600 great doctors with expertise in every specialty for adults, kids, and babies. More doctors, more expertise, more locations. Wherever you are, we are there. UMass Memorial Health Care. 855-UMass-MD.
Welcome back. Continuing our conversation on men's health, we're joined by Dr. Mitchel Sokoloff to talk about urology. One basic question, what is a urologist?
All right, so urology is a very broad medical field. It started really with the explosion of sexually transmitted diseases, and it was specialists who really looked at sexually transmitted diseases, the male genitalia, and disorders thereof. And then it's expanded, and now it's a field that has 9 or 10 subspecialties: transplant, cancer, pediatrics, voiding dysfunction, reconstruction, infertility, kidney stones. It's a very broad field that deals with anything dealing with the kidneys, ureters, bladder, prostate, external genitalia, urination in men and women, hormones in men and women. All of that is part of the urologic field.
Now, when a urologist talks about men's health, what specifically are they talking about?
Well, that's an interesting question. So men's health is basically a comprehensive approach to evaluating, identifying, preventing, and treating specific medical conditions that are unique to men. You know, men are a product of society and biology. Men's life expectancy is less than that of women. In the United States, there's a 7-year difference. Women, on average, will live to 79, men will live to 72. Is that due to genetics? Is that due to specific diseases? Or perhaps it's just lifestyle, risky behavior, more stresses, and studies have identified both. So the approach is to try to comprehensively treat a man for all of those issues to try to prolong his lifespan.
Now, these can be very personal issues. So how do you get men to engage and talk about these proactively?
Now, it's ironic. As a urologist, most men are pretty comfortable talking about just any topic, whether it's at a dinner party or whether it's in the office. And you can usually get people to mention this. I guess the real key, though, is getting them to the doctor in the first place. Once they get into our offices, it's usually pretty comfortable. And men, as most people know, are not the most proactive in terms of getting to the doctor's office and seeking treatment. So the goal really is to get to one's spouses or significant others, or even more importantly, just start to approach men at a younger age. Get the pediatricians, get the high school health clinics to really impart on those men how important healthcare is, so it becomes part of their routine. And part of a men's health program is more than just medical care. It's, what's the optimal diet through the different stages of life? What's going to help perhaps prevent prostate cancer? What's going to help maybe with muscle mass? What's going to help you stay lean and thin and not get diabetes? It's exercise programs that are specific for men and how they can, again, improve their health through exercise. So it's more than just health care. It's really a comprehensive approach to treating the entire male body.
One such issue is prostate cancer, and African American men seem more prone to prostate cancer with poorer outcomes once diagnosed. Can you explain why this is?
Absolutely. So prostate cancer, especially in disparate populations and underserved populations, something that's very, very I'm passionate about. It's a very important issue. And here in Worcester, it's even more important. So prostate cancer itself is a fairly controversial topic. Over the last 5 years, there's been a lot of questions about, do we need to treat for it? Do we need to diagnose it and treat it? Do we need to screen for it? And there have been some policy changes in the last 5 years which have really changed the number of men who are getting screened. In some ways, that's good, because we were probably over-screening and over-treating the disease. On the other hand, there's some very high-risk populations which are now not getting the screening they need. African American men are one of those groups, and they kind of have a double whammy. One, access to health care by itself is very limited to that population, and it's harder for those patients to get in to see a doctor and to get access to a doctor. And the second part is there is something about the African American man which makes them more prone to aggressive cancer. By the time prostate cancer is diagnosed in a black man, it tends to be more advanced, it tends to be more aggressive. By the time it's treated, it's less susceptible to being cured. Worcester County happens to have the highest rates of prostate cancer in African men in the state. It's almost twofold higher than that of Caucasians in the state and nationally as well. And it's also higher than African American communities throughout Massachusetts. It's definitely a healthcare crisis here in central Massachusetts. And we are very, very aggressive about education, getting to the black churches, getting to the black community, and letting patients know that they're at increased risk for this disease, how they can learn more about it, how they can get access to health care, and how we can perhaps identify and treat it at an earlier stage.
A prostate exam is important, but it can be quite invasive. What should men expect during a prostate exam, and what are doctors looking for?
So the prostate exam gives us a lot of information. What I'm feeling for as a urologist is really the texture and size of the prostate. Does a gentleman have an enlarged prostate, which can cause a whole host of symptoms? Does he have something that's firm or hard that would be consistent with a cancer? At the same time, we're also feeling the rectum. Could there be a rectal cancer? We can get a little bit of a stool sample and send it off for blood testing to see is there the possibility of blood, which could perhaps mean that there's colon cancer. So the test itself takes just seconds, but it is uncomfortable. It's a finger exam through the rectum. So usually we try to be pretty gentle, pretty soft, use lots of lubrication, and in general it just takes a few minutes, and most men tolerate it just fine.
Erectile dysfunction is also an issue for men. Is it generally an older man's problem, or is this something that affects a larger population?
So erectile dysfunction is seen in all age groups, but it is definitely more common as one gets older, whether it's just poor blood flow, whether the nerve endings aren't working as well, perhaps it's lower levels of testosterone and other male sex hormones. So it definitely increases as men get older. There are lots of different ways to treat it, and there are lots of etiologies that need to be explored. Some men have psychological issues which prevent them from getting erections. Then there are the physiologic causes. And fortunately, in the 2000s, we have lots of ways of treating it. There are the oral agents that you hear about, Viagra, Cialis, Levitra. Those all work very well in a good group of men. When those don't, there are injections men can give themselves, there are vacuum pumps, there are prostheses. We can basically allow any man to have a fairly satisfying sexual life well into their later decades of life, whether in their 80s or their 90s.
Now, there are some products, I think you mentioned a few, that don't require a prescription. So what do you recommend?
So we recommend going with prescription medications. A lot of the herbal remedies, a lot of the over-the-counter pharmaceuticals that have been developed for erectile dysfunction really don't work very well, and instead of a man spending a lot of money, he can see a physician. There are now generic versions of Viagra, so it's a lot less expensive. There are lots of different approaches, so hopefully it's affordable for most men. Now, erectile dysfunction is just one component of a men's health program. Speaking of men's health. So the reason that a men's health program really started in urology is that urologists have been dealing with men's issues for a long time. It was really the first place where men with erectile dysfunction would be evaluated, or men who have voiding dysfunction and can't urinate well, because those are all things that are germane to urology. As we realized that there are a lot of connections between these different disorders and diabetes, heart disease, as we realized that men are more comfortable sometimes seeing us than a primary care physician, there was just a natural evolution of, well, let's treat the man in general. Let's get maybe a multidisciplinary clinic where you have a cardiologist or a diabetes expert. Let's work with the exercise physiologist. Let's work with all of this to try to treat the man in general.
What are some things men can do to improve their urologic health?
So, as with every part of the human body, the best thing a man can do for himself is to eat well and to exercise. And by eating well, I don't mean going to a fancy restaurant and having lots of rich, fatty foods. It's to have that Mediterranean diet, or perhaps that DASH diet, one that has more vegetables, more fruits, less of the fats. Men in general need protein, so there are specific diets that are better for men that might have enough protein for an athletically involved man or someone who's doing a lot of exercise. But diet and exercise is where it starts. The second is just maintaining good preventive health. When you turn 50, get that colon cancer screening, whether it's a colonoscopy or whether it's a guaiac test. See your doctor, get that. When you hit 55, start talking to your doctor about prostate cancer and screening for prostate cancer. Some men should think about breast cancer. It's still not a very common cancer, but the prevalence has been increasing. And for younger men, testis cancer. Testis cancer is a rare cancer. There are only about 8,000 cases every year in the United States, but it's a very treatable and very curable cancer and happens in young men. There's been a lot of controversy whether men should do self-examinations, and different groups feel differently. The primary care groups tend to advise against it. The urology groups and the American Cancer Society tends to favor that men, once they reach adolescence and well into their 20s, 30s, 40s, do monthly self-exams to look for testis cancer. So these are all things that men can do to help stay on top of their health and prevent further illness down the road.
How helpful is exercise?
Exercise is key. It helps in so many ways. Not only does it help strengthen the bones and the muscle, it helps with the heart to perform at its top level, it helps the lungs, helps with well-being. There are often endorphins that are released so people feel better, their mood is better. It's very important.
You talked about colonoscopy. What are your recommendations for when a man should have a colonoscopy?
So the United States Preventative Task Force, the American Cancer Society, generally recommends that an average man start colon cancer screening at age 50. And that's usually going to be a colonoscopy or a sigmoidoscopy. And once that's done, and if something's found at that time, a doctor can then recommend when the next one should be. And those recommendations have changed. When I was a medical student, people were getting colonoscopies yearly or every other year. And then it went to every 5 years. I personally am on a schedule of every 10 years. Now, there are certain risk factors for colon cancer. So if someone has a strong family history of colon cancer, a strong family history of polyps, if there are some other genetic disorders that predispose to colon cancer, you might want to start a little bit earlier. And again, if a man is seeing a doctor throughout his lifespan, this will all be something they can help identify and guide the patient through his ages.
If we're looking at the big picture and men's health overall, what is the most critical issue?
I think the most critical issue is getting men to the doctor. Because once that happens, we can make them feel comfortable about what needs to be done. We can help counsel them on diet, exercise, prostate, testis cancer screening, avoiding dysfunction, heart disease, diabetes. All of those issues can be addressed. So it's just getting the man to the doctor, recognizing that men do have predispositions to certain diseases, that as men get older, the likelihood of getting different diseases increases, and just making them aware of that.
What age should, say, a men's health program start?
So ideally, a men's health program should be from adolescence till death. And there's a wonderful recommendation and a guideline checklist from the American Urologic Association, which actually breaks down ages from, I think it's 17 to 39, 40 to 49, 50 to 59, and then 60 and beyond. And for each one of those decades, there are different things to look for, whether it's erectile dysfunction when one gets older, and prostate cancer when one gets older. When one's younger, is it safe sex practices and just testis cancer screening? But there's some really good guidelines and checklists, but it really should be really through one's lifespan, from, again, adolescence all the way through death.
Dr. Mitchel Sokoloff, thank you very much for your time. We're going to take another break. We'll be back with more Health Watch In-Depth right after this.
Charter TV3 and UMass Memorial Health Care have teamed up to bring you the latest news and trends in healthcare. Health Watch, presented by UMass Memorial Health Care, brings you the healthcare topics that are important to you. From stroke prevention to allergies, skincare to sports injury prevention, and nutrition to pregnancy, Health Watch at UMass Memorial Health Care informs you on the issues that affect you on a daily basis. Health Watch on Charter TV3. For extended interviews with UMass Memorial Health Care experts, log on to our website.
For the latest in health trends and news, be sure to watch our Health Watch segments Wednesday nights on Worcester News Tonight at 10 p.m. and 11. Also, prior segments can be viewed on our website, www.chartertv3.com/health. Thanks for joining us for this edition of Health Watch In Depth. I'm Andy Madison. Have a great night.